Being an established healthcare facility means that there will be people counting on you for their survival and well-being. It is a heavy responsibility that can be daunting for those within the industry, especially during a global pandemic where lives are in danger at every single turn. However, a recent incident showed the world that a special kind of anarchist exists, one that would compromise the very same healthcare system that people depend on for their own gains. This is the fate that the Scripps healthcare facility had to go through. Let us take a closer look. Welcome to our channel. Today, we will be taking a look at the reported ransomware attack that took place at the Scripps healthcare facility. Make sure to like the video, subscribe to the channel, and click on the bell icon in order to support the channel and to ensure that you will not miss out on our future uploads. Without further ado, let us dive right into the video. First off, let us take a look at the history of today's subject, the healthcare facility itself. Scripps Health is a non-profit healthcare system that is based in the areas of San Diego, California. The system had humble beginnings that dated back to 1924. As a kind philanthropist named Ellen Browning Scripps took it upon herself to establish Scripps Memorial Hospital and the Scripps Metabolic Clinic in La Jolla, California. In the present, the system has grown all the way to 5 hospitals and 19 outpatient facilities. Due to its reputation and continued prowess, the system treats about 500,000 patients every year with the expertise of 2,600 affiliated physicians. The system is also a cornerstone for budding doctors as it includes clinical research and medical education programs. In 1995, Mercy Hospital, which was notoriously San Diego's longest established hospital and only Catholic healthcare facility, joined hands with the Scripps healthcare system. Mercy Hospital had its own history as the oldest hospital in San Diego, as it was founded in 1890. The now named Scripps Mercy Hospital even features campuses in San Diego and Chula Vista. Many other facilities exist within the Scripps system, with a few of them being the Scripps Green Hospital, Scripps Memorial Hospital Encinitas, the Scripps Clinic, and Scripps Coastal Medical Center. In 2002, Scripps Health gained notoriety for public switching its hospital's buying agent from Novation to MedAssets, revealing to the world that the system had issues with the fees that Novation had been collecting from medical supply companies. Scripps Health also revealed to the world that its newfound agreement with MedAssets will end up saving them $20 million to $25 million per year of the $212 million that the hospital network has been spending annually on supplies. The Scripps company gained further recognition when it was ranked 37th by Forbes magazine on its 2011 list of the 100 best companies to work for. Forbes went further to explain that this was largely due to the company's retirement program and contribution to society. Of course, over time, the facilities and services of Scripps Health only continued to grow, with them now even offering home health services, clinical research, medical education, comprehensive cancer care, and even genomic medicine programs. This is alongside comprehensive services such as organ and cell transplantation and online spinal fusion. March 2020 marked the time period when Scripps Health drafted a home health joint venture alongside Cornerstone Healthcare. The overall venture is to be looked after by an affiliate of Cornerstone itself. It is said that the launch of this partnership will be a huge boost when it came to providing home health services to San Diego patients. Now that we've covered their history, let us take a look at the news itself. Let us talk about the ransomware attack that took place. Over the weekend, it was showcased to the world how potentially dangerous cyber attack incidents are on healthcare providers, especially while a tough pandemic is breathing down our necks. The attack against Scripps Health in San Diego took the form of an elaborate ransomware attack. Edgar Capdeville, the CEO of Nozomi Networks, took the time to come forward and give his 2 cents regarding the situation. Showing just how low cyber criminals will go, the attack on a major healthcare facility like Scripps highlights the dark side of ransomware, disturbingly putting lives at risk. The truly sad reality is no one is immune from ransomware, and like good medicine, the best defense is prevention. Of course, Scripps Health took a soft approach to this when it came to revealing the details to the public. However, after reviewing some internal memos, the San Diego Tribune came out with a report that showcased the reality to be much crueler. Due to the cyber attack, the healthcare system was forced into EHR downtime, which meant that some of the critical care patients had to be redirected to other medical facilities after 2 of its 4 main hospitals and its backup servers that were located in Arizona were affected by the attack. The cyber attack blatantly put the lives of multiple patients in risk. To make matters worse, the Scripps system was forced to take down its MyScript patient portal for the time being, and even the services of medical imaging had to be taken down in the aftermath. The Scripps medical technology had to be taken aback an entire era in order for functionality to continue, as in order for telemetry monitoring to continue, they were forced to rely on paper records. As of yet, the Scripps healthcare system did not provide additional details regarding the attack, as they claimed that their technology servers were hacked and broken down. The experts that were brought in on the scene made their best guess, as they claimed that the attack had a high probability of being done through a phishing campaign. The style of the campaign took the form of spear phishing, which is defined as the fraudulent practice of sending emails ostensibly from a known or trusted sender in order to induce targeted individuals to reveal confidential information. However, 4 days after the statement, the state of disarray was still consistent within the system, and the company revealed that they could not say for certain if personal information had been compromised or not, which brings the integrity that the hospital spent decades building to question. Scripps eventually responded to a patient's online query, which was reported later on by NBC San Diego. We're still in the process of assessing the extent of this attack. If any patient's information was compromised, we will be reaching out to them. As of today, the website scripps.org is up and running. However, during the time of the statement, it was not. The COO of Axia, Jerome Beckert, came forward to give his perspective regarding this situation as well. As healthcare workers take on such a critical role in the pandemic and vaccine rollout, hospitals and healthcare providers need to ensure security in every aspect of their employees' work to prevent cyber attacks. He further elaborated, claiming that such fortification would include adopting multi-factor authentication, safeguarding against phishing and shoring up passwords that have been created for convenience. The less time healthcare employees spend logging in and out of systems, resetting passwords, or dealing with credential issues, the more time they can spend on their critical work, he went on to elaborate. Capdeville added on to this, claiming, "The truly sad reality is no one is immune from ransomware, and like good medicine, the best defense is prevention." An identity management expert from OneLogin, namely Alexa Slinger, commented on this, showcasing the desperation of the situation within the healthcare industry, even during these trying times. The healthcare industry is notorious for underspending on IT, and malicious actors know the data they can glean from a healthcare hack is especially lucrative in the dark market. It is clear that underspending in the Department of IT is definitely not a good idea in a world that is consistently transforming into a digital era. In a time where data brings profit, securing it should be a priority, especially for a healthcare company. Slinger went on to comment on the situation. Oftentimes, healthcare facilities are using outdated legacy infrastructure and unpatched hardware and software systems, which make them easy targets for hackers seeking valuable patient records and research data. In addition, healthcare systems are often highly connected, meaning that when a breach does impact one part of the system, it has the potential to bring down the whole system. Overall, all of these claims speak at one truth. Healthcare organizations around the world must consider the probability of ransomware attacks in their next incident response and business continuity plans. At least that is the opinion of Capdeville himself, as he further claimed, this includes training staff on the threat and the techniques cybercriminals will use to get into systems, and carrying continuous security monitoring across IT and OT networks to identify malicious activity or vulnerabilities that cybercriminals could exploit. He further went on to claim that the ones who are making the decisions in these healthcare companies need to be prepared to weigh the risks and consequences of whatever alternative action they're thinking to take during situations like this. Either way, this showcases exactly what a trying time the world is going through as of late, and the only hope of humanity happens to be the very healthcare industry that suffers from targeted cyber attacks by irresponsible individuals. With that, we have reached the end of today's video. Do you think Scripps will manage to ever find the individuals behind the attack? How afraid should healthcare companies be regarding their security? Let us know in the comments below. And if you wish to see more videos like this, subscribe to our channel and press that bell button to get an update every single time we upload a new video. Make sure to like this video and share it with your friends and family. Thanks for watching, and see you all next time.